Hi everyone, this is Dr. Carmen Jones, and I just wanted to hop on here real quick as I'm trying to compile a library of different topics and different ideas and ways to help folks. I had somebody ask if I would speak about indigestion, so I thought I'll take that opportunity and explain that to you here in a few minutes today. So indigestion can often also be known as acid reflux, heartburn. Medical terms, it's GERD, or the gastroesophageal reflux disease. And all that is that's describing the first part of our digestive tract, right? Oftentimes when I speak about the digestive system, I'm talking about the whole digestive tract from our mouth all the way to our anus. Today, I'm just going to give you a little introduction as to the esophagus and the connection with our stomach. So we're just focusing on sort of the top part of our digestion, right? And so what are the most common risk factors, right? Or even causes for indigestion, for acid reflux, heartburn, whichever term you prefer, right? So essentially what's happening, well, there's something that's called the LES, the lower esophageal sphincter, which is a sphincter or a valve that goes between the end of our esophagus and the beginning of our stomach, right? And that sphincter is supposed to close after we eat, so that as the stomach is churning and that using that stomach acid as it's churning, it doesn't reflux back up through our esophagus. That's the goal. That's what that lower esophageal sphincter is. That's the purpose of that, all right? And I'm going to talk to you a little bit more about that here in a little bit. But other risk factors can also be associated with a decrease of pressure on that LES, that lower esophageal sphincter. That can often be due to smoking, due to alcohol use, are usually the most common reasons why we see that sphincter having a lower pressure. We can also have acid reflux. Usually we see this sort of on occasion if it's because of the volume in our stomach, like for people who we have a tendency to overeat, right, and experience acid reflux. If there's specific triggers for some folks, sometimes things like orange juice, tomatoes, spicy food, all those things can increase the volume, can change the pressure, can all lead to acid reflux. And of course, increased pressure with pregnancy or obesity within the stomach can also lead to that acid reflux, right, or that heartburn. So why is this something that we need to worry about? Well, not only is it painful and uncomfortable that we experience those symptoms, but also if it is left untreated, what can happen is the more that acid irritates the esophagus, the tissue in the esophagus is fragile. It's not used to being exposed to that much acidity, unlike the tissue in the stomach. It's built to handle that acidity, right? So that can lead to cellular changes. It can lead to something called esophagitis, which is inflammation of the esophagus. If continued to left untreated, that can turn into ulcers, right, which can be very painful. So looking at how to address that, how to begin to address our acid reflux, right, naturally. I wanted to real quick talk about some conventional treatments that you guys are probably all familiar with. Things like antacids, right, Tums, Alka-Seltzer, sometimes those could be really helpful. Oftentimes they're just short-term fixes as far as reducing the acidity, reducing that pressure, so you don't have as much acid reflux. There are some over-the-counter medications out there. There's something called histamine 2 receptor blockers, antagonists. Things like Pepcid and Zantac fall underneath that category. There are what they call PPIs, which is proton pump inhibitors. They and the histamine blockers have a tendency to, or the mechanism is that they reduce the amount of acid that our stomach makes, okay? So that when things reflux into our esophagus, it doesn't burn or it's not painful, right? As painful anyhow, because the tissue or the fluid is still refluxing, but it's not as painful because it's not as acidic as it's refluxing. Those PPIs are over-the-counter things like the Prilosec, Prevacid, Nexium that we hear about, right? The challenge is that those can help with the symptoms, but they don't always work at getting to the root cause, right? So I do have some ideas to also help to address some of those symptoms naturally, because a lot of these prescriptions don't go without side effects, right? The positive side effect is that you don't have the symptoms, and so you feel a little bit better. But the challenge is that when we're taking in those PPIs and those H2 receptor antagonists, is that you're reducing the amount of acidity in the stomach, okay? That changes the environment of the stomach. And if you guys have heard me talk before, I'm a visual learner, so I like to show people pictures, right, to kind of bring the point home. So real quick, I just want to share this picture with you to kind of give you a better idea, all right? So this is thinking about the stomach, right? Thinking of it sort of as an environmental issue, right? Here on the left, we have kind of that tundra. Nothing is really living there, right? It's too cold for things to survive, for bacteria, for microorganisms to survive. That's what our stomach wants to be, right? Our stomach wants to be that pH of 1 to 3, that very acidic environment where things aren't supposed to grow, right? It's there because it's trying, or that acidity is there because it's trying to break down our food so we can free or assimilate the nutrients, the vitamins, the minerals, the things within our food that our body, to nourish our body, right? When we take in, antacids or any of the proton pump inhibitors or the histamine 2 antagonists, we're changing that environment, okay? So instead of that pH being that 1 to 2, the 3, we may not be changing it a lot drastically as far as the pH scale goes, but we may be changing that environment to more of a pH of a 4 or 5. So it's still acidic because it's still less than 7, but it is also getting the opportunity with it being less acidic to promote growth, right, of bacteria. So in contrast to this tundra where nothing can grow, this environment of no growth, by changing that pH just a little bit, right, we can promote growth of bacteria in our stomach, right? So then, as in contrast, is rainforest where everything's like green and lush, right? This is what it has a tendency to happen when we take long-term antacids or proton pump inhibitors or histamine 2 receptor antagonists, like the Pepcid, the Nexium, the Zantac, any of those, right? So you can see that if we are promoting an environment in our stomach that it's a lot like this lush rainforest where things can grow and prosper, our stomach's not able to break down the things that we need. We're also more susceptible to bacterial infections, viral infections, parasitic infections, and that sort of thing. So we talk about it's an environmental issue. It is, because our body is trying to promote, there we go, our body's trying to promote that acidic environment in the stomach, right? So that's the best way it can kind of break down things. So just keep that in mind when you experience antacid, if you experience heartburn, especially if it's a long-term thing, right? Or if you've been on medication, one of these that I've listed for months, for years, consider what's changing in your body, all right? And I would challenge you to let's find things to rebalance that so that we can promote optimal health and we also don't change things downstream in our gut system or in our digestive system and in our gut, but also all the other components that are associated with our gut health. I'm going to talk about this in another video, but things like our neurotransmitters and our mood, our mental health, and how that's associated with our gut. Our immune system, how that's associated with our gut, our detox pathways, our ability to break down things, metabolize things so that we can detox from things that we're exposed to in the environment. All of that balances on our gut health. And so it's so important to think at the beginning, right, how we are changing things downstream. So If you are a person who has a tendency to experience heartburn or acid reflux occasionally, right? Maybe you know that it's associated with that you ate too much, or you ate foods that trigger it, like the coffee, caffeine, alcohol, sometimes orange juice, tomatoes, those sorts of things. Let's see, fatty foods can also trigger it. So if those are sort of situational, right? And if you need something acutely to address that, there's some things that we can do without having to reach for one of the antacids, right? Things like aloe vera juice. There's a whole category of herbs or botanical medicine or herbal medicine that we call demulcents, right? Demulcents are things that are slippery or slimy. So things like okra, things like cactus, if you've heard of slippery elm, marshmallow or althea, aloe vera, those things that have a tendency to be a little bit slimy, those are demulcents, and they work very well at coating our mucous membranes in our esophagus, but also in our through our whole digestive tract, in our stomach, and all the way down to our small and lower intestines. And so by taking demulcent herbs like those that I listed can be really helpful in soothing the tissues so that you don't experience that pain, right? So if it's something acute, I often have people consider, right, doing a large glass of water and 2 tablespoons of aloe vera juice, because aloe vera juice is usually pretty easy to get. You can use aloe vera juice from if you grow aloe vera, right, you can buy it from the store nowadays. If you grow your own aloe vera and you want to use the aloe vera that you have at home, usually the wider or the bigger the pieces, the easier it is to harvest. But you want to take that piece of aloe vera and you want to cut it lengthwise, okay? So don't chop it up into small little pieces, but cut it lengthwise and then scoop out the middle with a spoon. And that will get you the active constituents, the demulcent properties, versus if you cut it into little pieces, and sometimes people will put it in a blender, then you're not just getting the demulcent properties or the gel, but you're also getting what they call the latex, which if you ever cut a piece of aloe vera, sometimes when you break it, it'll be like a little yellowy substance will come out. That's usually the latex, and that can cause loose stools or diarrhea. So that'd be better for somebody who's constipated. So aloe vera is a wonderful thing to try. If you are familiar with a lot of herbs, you may have heard of slippery elm gruel. It works really well. I'm not always a big proponent about sharing slippery elm gruel because it's not a sustainably harvested plant right now, and it's on the endangered list. So consider doing something like Althea officinalis or marshmallow. That is, marshmallow falls in the family of, I just lost it, Rose of Sharon. So if you've ever seen sort of, Rose of Sharon plants or bushes that people have growing in your yard, the family is similar to Althea. And so you can get marshmallow root and make marshmallows out of it, but you can get marshmallow root and make a gruel out of that. To help to soothe those tissues and reduce that heartburn pain. Oftentimes I have people, if they wanted to try that, it takes marshmallow powder and water, and that's about it. Usually I have people take about a tablespoon of marshmallow powder to 1 cup of boiling water and mix it and then let it set and let it cool off. The longer it cools, it'll get a little bit slimy. You'll see it'll get a little bit thicker, and then drink that 2 or 3 times throughout the day. To help to soothe those tissues, okay? Now, if you are taking one of these PPIs, Prilosec, Prevacid, or Nexium, and you wanted to get off of that, I give everybody a little bit of caution. Check with your doctor first, because you can have rebound acidity where the heartburn or the acid reflux can get worse because it's so used to being suppressed, that acidity being suppressed for so long. So keep that in mind. Some other things that you might consider doing are cutting out things that are triggers. So oftentimes we see things like dairy, that includes milk, cheese, yogurts, ice cream. can be a trigger for acid reflux, as well as wheat. Gluten can also be a trigger for acid reflux. It's a little bit lesser known. So you might consider cutting those things out of your diet if you have a tendency to have chronic heartburn. All right. Now I'm going to share with you a little bit. So I talked about that LES, that lower esophageal sphincter that goes between the bottom of the esophagus and the top of the stomach. So we talked about, right, that sphincter, if it's closed, we won't have reflux because that's its job, is to keep the acid in the stomach and keep it from being, from refluxing into the esophagus. Well, the signal that tells that lower esophageal sphincter to close is the presence of acidity in our stomach, okay? We know that when we eat food, our body says, hey, there's food in our stomach. We need more acid to break down that food, right, before it gets into the small intestine. And so the idea is your stomach and your pancreas is dumping enzymes and hydrochloric acid into the air to break down the food. Well, that should also be a trigger for that LES, that lower esophageal sphincter, to close, right? Well, when we're taking a lot of antacids or PPIs or any of these, what's happening, like I said, is that that sphincter isn't closed, but it's just reducing the acidity of the fluid that is getting refluxed, okay? So what I propose you guys try and challenge you is that let's do things to stimulate the stomach's acidity, which is the natural environment, right? That picture, that tundra that we're looking for, that it's inhabitable, right? So that we can begin to actually break down our foods and get the vitamins and minerals and nutrients out of our foods that we're trying to eat to nourish our body. So how can we stimulate acidity in the stomach, right? Apple cider vinegar is sort of my go-to. So apple cider vinegar, I usually have people start out with about a tablespoon a day. So if apple cider vinegar, if you have severe acid reflux and you've had trouble with it for years, usually I have people aim at taking a tablespoon. I have them start with 3 teaspoons or 1 tablespoon a day, right? So it'd be 1 teaspoon for every meal. If you feel like that's helping, but it's not enough, you can take up to 1 tablespoon with every meal, right? Some people only experience heartburn first thing in the morning or when they go to bed at night. If that's you, then you may only need to take 1 tablespoon of apple cider vinegar during that time, that time of day that you usually experience those symptoms the worst. So the idea is that apple cider vinegar is acidic, so it will stimulate the acidity in our stomach, which will in turn send that signal to that lower esophageal sphincter, so it will actually close like it's supposed to, and then we don't experience the reflux symptoms, not because there's not acid, but because it's actually doesn't have anywhere to go, right? It's staying in the stomach. So sometimes apple cider vinegar can be a little bit harsh for some people. So I often recommend that people dilute it or put it in water. I usually have people do like a 1 or 2 ounces of water. So maybe a tablespoon of apple cider vinegar to 2 tablespoons of water. Take it really quickly, follow it up with just plain water to stimulate the acidity in the stomach. Now, sometimes if you've been taking antacids, again, talk to your doctor, reach out, give me a call to figure out what that weaning process is so you don't get the rebound acidity. But you can do the apple cider vinegar and those antacids at the same time for a little while before, you start that weaning process. So, perfect. I hope that gave you guys some new information, a different perspective on indigestion. Keep an eye out for some of my other videos where I'm going to talk about lower parts of our digestive tract. If I can help you out individually to address your indigestion or your acid reflux or any gut issues that you have, I'd be happy to try and help. So please reach out. If you're watching this video and you have questions, leave me a comment in the underneath and tag me if I don't get a chance to see it, and I will do my best to answer any of your questions. All right? I hope that you guys have a great day.